Good morning and salam sejahtera to all our distinguished guests today. Welcome to the Picaso Robotic and MIS Exchange of 2025.
So we're now performing a robotic anterior resection, and the surgery is for a high rectal tumor. So the surgeon is none other than the world-renowned Korean surgeon, Professor Kim Seong-han.
This afternoon, we are going to do a robotic right inguinal hernia repair. We are here to fix the hernia by using robot.
So I've just completed the case of prostatectomy robotically in a little bit over an hour, and I think these patients can expect a very smooth recovery.
Good afternoon, we will have another case, which is a kidney tumor. So the plan is do a robotic assisted transperitoneal partial nephrectomy for the patient.
We just did a live surgery, robotic V-node hysterectomy. Basically, we use the robot and we do a V-node surgery to remove the uterus.
So even with a big uterus because of fibroids or any disease, women can still have a scar surgery and recover fast and get the problem sorted out.